So Rose and I are going to be presenting Kinesio tape. What Kinesio tape is a brand of therapeutic tape that's made out of cotton fiber. It has an acrylic adhesive that's heat activated, and in the corner here you can see the pattern on the right hand corner that the acrylic is applied in. It's latex free, it's waterproof, it lasts up to 3 to 5 days on your skin, and the idea is it's designed to mimic your epidermis, so it's thin, it's breathable, it's comfortable on your skin. It stretches about 40 to 60% of its resting length and can be applied to in many different shapes, creating all kinds of different effects we're going to talk about. So the KT method, which you need to take a course in order to learn how to properly apply the tape, states that the tape can re-educate the neuromuscular system. So it creates tactile sensation on the skin, which then stimulates the mechanoreceptors and increases the motor units in the area of application. If you're running the tape from origin to insertion, then you're going to create a pull similar to a muscle contraction. If you're running it from insertion to origin, you're going to create a stretch. So you're going to decrease tension in that area. You can improve lymph and blood flow. You can decrease pain using our gate control theory we learned about. You can stabilize unstable joints. And then other sources other than the company have also said it may improve joint proprioception, it may support tendons and ligaments, it may promote improved posture, improve flexibility, and even correct scar formation. So the theory behind it is that you pull the tape and you place it, and when the tape recoils, it pulls the skin back and creates these little bumps, these little convolutions in the skin, as you can see in the image here. And that gives the blood vessels and lymphatic tissue, just the tissue in between there, some space between the muscle and the fascia and skin so that you get some blood coming in, you get some lymphatic fluid coming out, you get some decompression on those pain receptors, which are then going to send less pain signals back to the brain. So that's the theory behind how it works. So the percent of stretch is very important in the effect. Light and moderate stretches are going to create those pain and edema effects we were talking about. Severe and full stretch are going to create those muscle and tendon and ligament effects we were talking about. And then you can adjust the shape to create different effects. So the eye is kind of your standard, that's the top right corner over here. And then these other ones are just different designs. The bottom left is a fan, and that dot is an anchor, and then the branches come out and create tension pulling back and lifting the skin in that direction. So that's how the tape tends to work. Now, these are just some examples of it in action. So we have some bruising here, some leaking blood. So where they applied the tape, they use the fan shape to kind of pull the blood out of the area, and you can definitely see that where the tape has been applied, there's been some healing of the bruise. For swelling, they've done some layering here, which is very common to layer them. You'll see more of that coming up. Layering on the left ankle, and then the right ankle, they've created a concentration gradient, pulling some of the fluid back up the ankle. So these are some other techniques. Post-op care, obviously you're going to have some crazy layering because you've got a lot going on in that knee. So they're doing a lot for swelling. So this is just an example of just how you can layer and how you can change this. Then you've got neuromuscular pain, which this clinician has done also a lot of layering. You're seeing some different techniques, some different shapes. So as you can see, there's a lot of different techniques you can use with the tape, and you can come up with some crazy shapes like this. So contraindications, you don't want to put it in any malignant areas. You don't want to have any DVTs. Definitely not over the belly button, not over the axilla or the groin because there's hair there. And then you just want to put it on healthy skin. So if the skin is in any way, deconditioned, then you don't want to put it there. So precautions, any of these diseases listed, you just want to keep an eye on these people because they could potentially have negative symptoms from the tape. And now Rose is going to do a little demo for us.
So we have two different kinds of tapes here to show you. These are the two that I just had at home. So this is the KT tape brand. This is a Health Star brand. I got them both at Marshall's or CVS, but you can get them anywhere, Walmart, whatever works. They're very similar to the Kinesio tape brand. They just target more directly to the consumer rather than to a therapist or to a clinic. So the KT tape comes in pre-cut strips. The Health Star comes in a roll. They do the same thing, you just have to cut this one instead. So I'll show you a demo now on how to do a common shoulder taping. So we're gonna come into the demo part of this. Our patient was nice enough to shave his arm for us. So the first step of applying Kinesio tape is that it needs to be on pretty hairless skin. So he has pretty hairy arms, so it wasn't gonna stick. And I've seen that a lot before where patients, if they really wanna try the tape, they have to shave whatever body part is, whether it's their knee or their shins or their foot or whatever it is, they have to shave it because it really won't stick to hair very well. So we shave this. The next thing you would do is you would clean it. So you can either use an alcohol wipe or you can use like a Purell on a towel just to make sure the skin is nice and clean, like there's no lotion. If you were to massage the patient first, there might be some massage gel left over. So you just want to make sure that there's nothing on the skin at all or else the tape won't stick. I'm going to use the KT strips just because they're already pre-cut and the edges are already pre-round. The round edges helps the tape stick so it doesn't get caught on clothes or like if you're itching something, it won't get caught as easily. But if you were to use the other kind of tape, you would just round off the edges with scissors. But we're going to put that to the side. So this taping method is going to be for general shoulder pain. It is a KT tape strategy that they use, that they give you these little pamphlets in the boxes, and you can get all the videos on YouTube. So this is the one that they recommend for general shoulder pain. So what you would do is you would take the piece of tape, you're going to turn it towards you, tape side up. You will peel off and cut like a 2-inch anchor from the front. So this is the part that's going to stick to them first. So you can peel that part off, fold it over, hold on to it. You're gonna have the patient take their arm and bring it around the chest. And then you are pinning this anchor here right at the bottom of the deltoid. You're gonna come down and attach it. So you want your anchors to never have tension on them. It helps it stick to the skin. And then you just flip the tail over. You are going to peel off here, and you can see that the adhesive, I don't know if you can see from there, but the adhesive kind of has a little pattern on it that helps it stick. Put it back. And then, so you're gonna peel the backing until you get to about 2 inches from the end, and you're gonna pull the tape around the back of the shoulder and the deltoid at about a 20% stretch. Our 20% stretch is gonna end there. And then we have another 2-inch anchor at the top that we are just gonna apply with no tension, no stretch. And then you just rub over to make sure it's all stuck down nicely. Beautiful. And then you'll have the patient bring their arm backwards. Good. And you're gonna do the same thing for the front. So the 2-inch anchor, we are gonna come down right in front of our last piece of tape. Get that stuck on there good. We will peel up again, leaving that 2 inches at the end there. And if you leave the backing on, it makes it easy to hold so you don't have to like finger all around the tape. And then just turn away from me so I don't stab you in the face. We'll come here around the front of the shoulder. And then that last 2 inches is gonna have no tension again. So 20% tension through the center of the tape, and then 0% tension at the bottom and top 2 inches. You can rub it around there, and then he is good to go. So this is good. He can shower with it. The only thing you want to caution your patients if you were to use this is that you want to make sure that they are not going to rub it off in the shower, but they can shower just to pat it dry when it's done. And if it starts to get itchy or irritated, they can just gently peel it off. You don't want to rip it off, but just peel up the edges and gently pull it off after that. Does it feel good?
I am healed.